Hello everyone, my name is Maria Costa and today I'll talk about anxiety disorder. After this presentation, you'll be able to tell what is anxiety disorder. What are the symptoms of anxiety disorder? You'll be able to identify the types and the causes of anxiety disorder. What is the difference between worry and anxiety? What are the complications and the diagnosis of anxiety disorder? And last but not least, what are the treatments for anxiety disorder? What is anxiety? Anxiety is a mental health disorder characterized by feelings of worry, anxiety, or fear that are strong enough to interfere with one's daily activity and ability to function. Anxiety can make you avoid work, school, family get together, and other social situations. Anxiety disorder is one of the most common mental health disorders. Now I'll talk about some of the symptoms, most common symptoms of the anxiety disorder. A person with anxiety disorder should have trouble concentrating, should have problems with grades at school, um, with functioning at work. A person with anxiety disorder should also feel irritable with anything or everything can make a person with anxiety irritable. A person with anxiety disorder should have physical symptoms like nausea, abdominal pain, heart palpitation. A person with anxiety disorder should often have her hands and feet sweating and also a problem with anxiety she'll have a problem to sleep because she'll be overthinking a problem like over and over again, and this can consume a lot of energy. So the person, she can sleep all night but she'll be in the morning, she'll be always tired because she don't have energy because of the overthinking. The most common types of anxiety disorder. First is generalized anxiety disorder or GAD. It's a mental health condition that causes fear, constant feeling of being overwhelmed, and excessive worry. A person should be worried about everything every day in her life. A social anxiety disorder or SAD is the person that she'll have social phobia. She'll not go out or any family get together. She'll not have much friends. Obsessive compulsive disorder or OCD is the repeat over and over of certain routines like cleaning, organizing. A specific phobia, I would say, for example, arachnophobia, that's the fear of spiders, or panic disorder. Panic disorder is a sudden period of intense fear that can occur unexpectedly or by an object or situation that will trigger the fear. The researchers, they don't know for sure what can cause anxiety disorders. One of the causes can be genetics. If your mom have anxiety, you're probably gonna have anxiety too. Brain chemistry, some imbalance of hormones or neurotransmitters like epinephrine, norepinephrine can cause anxiety. Environmental stress, for example, at work. If you're not happy at work, you're probably gonna have anxiety. Drug withdrawal or misuse. For example, an alcoholic person, if they stop use alcohol, they're gonna have anxiety. In some medical conditions, for example, some diagnosis of cancer, for example, a person should have uh, anxiety if she has a diagnosis of cancer, for example. What is the difference between worry and anxiety? Worry and anxiety are two different things. Worry, it's more mental. Anxiety, it's more physical, can cause more physical symptoms. Worry can be more specific. For example, I'm worried about that I'm gonna miss my flight, or an anxiety, it's when you have, fear of miss the flight, for example. So it's a two completely different feelings. We can say there is a lot of complications of anxiety disorder, but one of the most dangerous one is the suicidal thoughts. The person she will no longer wants to live because she will have so much anxiety and she will no longer functioning or socialize or she'll have chronic pain, digestive issues, all of the physical symptoms that I talked about before. Your primary care physician can help you with the diagnosis of anxiety disorder because they can rule out other physical conditions. But the most qualified professional that can help you with the diagnosis will be the mental health specialist, like a psychologist or psychiatrist. They will be more specific. They will analyze your behavior, your feelings. They more qualified for that. To give you a diagnosis of anxiety disorder. And finally, how are you going to treat your anxiety disorder? The treatment for anxiety disorder is going to be a combination of self-care, therapies, and medication. For example, you're going to avoid everything that causes you anxiety: alcohol, caffeine. You're going to quit smoking. You're going to do some exercises. You're going to change your habits, bad habits to good habits. Meditation can help, psychotherapy, and some medications. I hope you enjoyed this presentation. Thank you for your time.